tracking devices are not new, but the pandemic has encouraged the rise of innovative new kit, or sometimes all you need is your smartphone. This app from Binary AI uses the camera built into your smartphone, tablet or laptop to measure your vital signs in under a minute just by looking at your face.
So Bina is actually analyzing the tiny color changes that are happening in your cheeks and forehead. And those tiny color changes actually provide a clear indication regarding the blood flow behind your skin. And by analyzing the blood flow, then we're able to analyze and to understand what is your heart rate, what is your oxygen saturation, what is your respiration rate, and a lot of different body signs.
Over 100 million scans have already been done, and thousands of doctors have been trialling the tool whilst it applies for wide-scale approvals. But to get a second opinion, and one from an actual doctor, I drafted in Claire Gerarda, GP and former chair of the Royal College of General Practitioners.
So under your skin, you've got millions of very small blood vessels. And what this technology, no doubt, is actually pinning one of those down and picking up these various indices.
Another smartphone-based solution could be this. LMD's tiny device can track your blood pressure just by holding your finger down on it. Its sensors track the pressure that you're putting on along with what the vessels look like under the skin. It did take quite a few goes to get a reading, but the company is improving its set of simple games to help you focus on getting it right, and clinical trials are underway. You've mentioned how beneficial this could be to people who know they need to be taking their blood pressure readings, but how about to healthy people?
It would be very, very useful to be picking up people that we don't normally see in our surgery till they run into problems.
Sometimes your phone may need a bit of help though. This smartphone-connected device aims to help you when you're having a remote doctor's appointment. Now, it comes with attachments that help you look inside your ear or inside your throat, even a stethoscope, plus simpler functions like being able to take your temperature. An app helps you record your findings and send them to a doctor. Or if your healthcare provider is signed up, you can do live video calls where they take control.
Heart is awesome. Let's go to spot 2.
Oh,
You're going to go directly across.
A lot of schools around the US and Europe is starting to use Taito as a mini clinic. We have visiting nurses services that are using Taito. So it's not always at the home level, it's also at the community level.
Taito Care has been clinically validated by universities and hospitals in the US and Israel. But not everyone's convinced that parents should be buying their own $300 device. What do you think of a device like this, which actually takes on some of the physical elements of what a doctor would generally need to do?
I think that if you're a worried parent, number one, you probably wouldn't have one. If you're anxious, where you're looking for all the bits, in the midst of being unwell, I think you won't find there's much usage. Where it might be useful is if we're trying to monitor a patient at home. So if I've seen a patient, say, on a Friday morning, and I'm a little bit concerned, is this child unwell or not unwell, I might lend a patient's parent that machine.
But moving forward, do you think that these things are still going to stay with us? There'll be as much enthusiasm in the future?
COVID has really done a paradigm shift. Saying that, I don't ever think it will get beyond 60% of consultations will start and finish online. I think there'll still be a large number of patients that see their doctor face to face for all sorts of reasons.